Welcome to the Making Kids Count podcast, brought to you by Kentucky Youth Advocates, where we sit down with policymakers, community leaders, and youth to discuss ideas to make Kentucky the best place to be young.
This is Shannon Moody, Executive Director of Kentucky Youth Advocates. Thanks for tuning in to the Making Kids Count podcast. Today, I am joined by two KYA leaders and valued colleagues here at Kentucky Youth Advocates, Alicia Watley and Corinna Cash. Alicia is our Senior Policy and Advocacy Director. She leads our Blueprint for Kentucky's Children efforts to advance state-level policies that are good for kids. She's also your local Kentucky Oral Health Coalition lead. And Corinna is our Data and Research Director. She leads our longstanding Kentucky Kids Count project that shares the latest data on child well-being with advocates and decision makers and is a data dashboard guru. So welcome to you both. I'm so glad to have you on the podcast today. We're going to discuss the latest National Kids Count data book with Corinna and Alicia. They've recently shared that Kids Count data book with the Kentucky General Assembly at the July interim Joint Committee meeting on families and children that is led by Representative Samara Heverin and Senator Danny Carroll. So we're going to jump right in and talk about that data book. So the Annie E. Casey Foundation released their annual report card on child well-being in June, offering the latest data on child health, education, economic security, and family and community factors. The data book offers the important snapshots on how Kentucky kids are faring compared to years past and to other states. So Corinna, can you give our listeners a quick breakdown of this year's overall findings for Kentucky?
I can. First, thank you for having me on today. Great to be here. Whenever we look at where Kentucky ranks in the Kids Count book, we see that Kentucky ranks 36 among all states for child well-being. And whenever we're talking about child well-being within Kids Count, we're really talking about 4 key domains: their economic security, their health, their education, and the families and communities that they live in. So we ranked 36 overall for child well-being, but as we dig into the domains, we see quite a bit of variance in where Kentucky lands. Looking at our education domain, we ranked 22nd, and looking at the data indicators tracked within education, despite that being our highest domain, we do have worse rates in 3 of those indicators. Our second highest domain was health, where we ranked 31st overall. And once again, we saw worse rates in 3 out of those 4 indicators. Our next domain was economic well-being. We ranked 39th overall. But in that domain, we did see 2 of our indicators: children in poverty and children living in families where no parent has full-time year-round employment. We saw both of those indicators improve over the baseline. And then our final domain is our worst ranked domain of family and community. We ranked 44th there, but every single indicator within that domain, we saw better improved rates of. Looking overall, we see continued positive trend lines in students graduating on time, in teen births, and in child obesity rates. However, we continue to see poor rates of young children not in school, 4th grade reading, and 8th grade math proficiency.
So for the fellow data geeks listening to this podcast, so I hope they're really going to dig into what we're talking about here. Corinna, can you talk a little bit more about other things that stand out from the data book?
Yeah, so to me, kind of the biggest takeaway is despite doing better in children in poverty, we still see that 1 in 5 Kentucky kids, or approximately 192,000 children, are in poverty. We know that if a child is living in poverty, if they can't even meet that baseline of having their basic needs met, because we know that even children above the poverty line can't necessarily make their basic needs, we can't expect them to thrive in any other indicator. We can't expect them to thrive when it comes to healthcare outcomes, when it comes to healthy food access, when it comes to their education, and especially if they're living in high poverty areas. We can't expect their community as a whole to thrive if they're living in poverty. So to me, that's the biggest takeaway, is that too many Kentucky kids continue to live below that threshold and can't get the resources they need. Looking at some of our other domains, so education, like I said, is Kentucky's strongest domain in comparison to other states. And in that, we saw some of our indicators actually rank in the top 10 of all states. So our high school graduation rate, we had the second highest rate in the nation, which is huge, really something to celebrate. And then we were the 10th highest rate of fourth grade reading proficiency in the country. That's also something huge, something to celebrate. I know something the legislature spent a lot of time over the last couple of years addressing. However, I will say that despite having the 10th highest rate of fourth grade reading proficiency, we did only see 1 out of every 3 fourth graders scoring that reading proficiency. So 2 out of every 3 are not reading at grade level. They're not meeting that mark, showing that we have a lot of room to improve. If we look at that 8th grade math proficiency too, we see that 3 and 4 8th graders scored below proficient in math in 2024, which is a worse rank than 2019. So there's certainly work to do in terms of getting kids up to speed where they need to be when it comes to math. Also in that domain, we see that young children not in school. Kentucky ranked in the bottom 10 in the country for that indicator. We had the 44th lowest rate of young children in school. And we know that education starts really young. If kids aren't entering school when they're really young, they're playing catch up when they enter, and it's harder for them to meet those proficiency rates later on. One indicator that was exciting to see was a reduction in children and teens who are overweight or obese. We saw that decrease from 37% to 33% in the most recent data, which is a promising improvement. Kentucky also scored in the bottom 10 states in this indicator, but seeing that improvement is huge and shows we're moving in that right direction in terms of ensuring kids have that access to healthy foods, their access to play and exercise, and the things they need to maintain a healthy weight.
Mm-hmm. And we know that our legislature talked about this, especially within the Make America Healthy Again Kentucky task force about, addressing childhood obesity and making sure that there's access to healthy foods. We've also heard from our legislators in a couple of these different domains that you're talking about, Corinna, that, that apply to policy in the way that they are thinking about moving ahead with making some policy changes. Alicia, from a state policy perspective, what really stood out to you in the Kentucky's child well-being trends from the book?
Yeah, thanks, Shannon. I think that it's always really encouraging to see some of the progress in some of the areas that Corinna mentioned, and also knowing that state level policy has such an impact on these indicators and how we can really move the data in the right direction as far as child outcomes. But a couple of areas that I think need a little bit more attention and maybe have some policy implications here in Kentucky are around our housing costs. We know that from the data this year, we rank 11th in the nation of the percent of children who are living in a household that is burdened by high rental cost. So it actually has remained the same. So it's still at 23%, which is what the last measure was as well. But this is a measure that looks at, living in a household where your rent or your housing costs are above a certain percentage of the income of the household. So it really takes away from being able to meet other basic needs, as Corinna was talking about, that are so important if folks are not able to afford their housing. And we know that there's been a lot of ongoing efforts with this in Frankfort already. Our policymakers are paying attention to housing right now. They have been for the last couple of years. We've seen, actually for 2 years now, a task force has been convened in Frankfort to really dig into housing. They're thinking about what does, the market look like? Do we have enough units across the state? Do we have availability that is stable and affordable for the families that need it? There's a lot of questions that they've asked and a lot of data they've been digging into in this area. And we've also seen out of that some recommendations and a lot of legislation filed actually in the last couple of years in Kentucky trying to address this housing issue. And unfortunately, we haven't seen a whole lot of those bills that are passing and really seeing that impact just yet. But I think that this data just kind of continues to underscore the need there. I think we need our state lawmakers to continue to pay attention. They have been, but put that effort behind it again in 2027 to think about what would it look like to ensure that our families have those stable homes. And when we think about affordable housing, I think we have to consider what that means for kids, to really have that safe and stable place to go home to at night. It's so foundational to everything else that they have access to throughout their days. So, being able, the opportunity really to create community is so important. And if we don't have stable housing, that really has an impact. Being able to meaningfully engage in their education at school, showing up to school regularly, staying in the same schools over time, and really just thriving in all other areas of their life. I think it's so foundational to have that housing taken care of. So that's
Yeah.
something that really stood out to me when I was looking at some of the numbers. And another one that I want to highlight, that is definitely a concern, but I think has some really clear policy implications, is the child and teen death rate. Certainly remaining an area of concern. The rate has increased previously from 29 deaths per 100,000 children back in 2019 to 31 deaths per 100,000 children at the latest measure. And I think that this is the data itself talks about where those trends are coming from. And so two of the things that are pulled out are accidental ingestions and overdoses, and then also suicide as a result of firearms for young people. And we've been hearing about these issues in Kentucky for some time. So I think this data kind of confirms what we've been seeing. And so we currently are ranking 30th in the nation on this indicator. Now, this is an area that it's not fun to talk about. It's not something that people want to think about, that this is happening in our state, but it is an area that I think we can target some solutions to. So not only do we have those overall numbers of how many fatalities we're seeing, but we can really pinpoint some of the causes and think specifically about how to prevent those. There's so much opportunity for prevention in this area. And so I think that one of the things that we can focus in on is youth mental health. When we talk about the suicide rate, and the growing rate of kids that are attempting or completing suicide in the state, we know that mental health has been a concern for quite some time across the youth population across the nation and here in Kentucky. But how can we better support kids? Implementing programs that are preventive, to make sure that they have what they need, have basic needs met, and then also have access to any needed treatment. So if we can't prevent the mental health concerns from happening, how are we supporting and wrapping around those kids to make sure that they have that reduced risk of suicide? And then I think beyond that, a pretty clear direction there is to also be thinking about the method, which is firearm access. So are we considering safe storage of firearms? That's something that we've talked about in the past, and I think it continues to be on the mind of folks for youth access there. And then the other one that was highlighted, and we heard about this actually in the committee last week as well, or earlier this week, is accidental ingestions. So this is kids getting a hold of really all kinds of different substances in the household. Some of them could be illicit substances, but some of them could be prescription medications or even over-the-counter medications that are pretty commonplace in the household. And so again, I think it's just really being intentional about prevention here. How can we be thinking about packages and warnings, and also bolstering education to caregivers about how to safely store things in their home? Because these are not all like illicit drugs that you shouldn't have. They're going to be things that people have in their homes. And it's just a matter of how do we keep them out of the hands of kids? And so is that, lock boxes or other type of procedures in the house that would keep them safe. So we've seen some progress in this area. We definitely could make more progress in this area, but the good news about this is that there's a lot of prevention that can be done. So it definitely feels like we can target some solutions and work with our lawmakers on how to make that happen.
Yeah. And I know that you all, prior to your all's presentation with the interim joint committee meeting on families and children, Dr. Melissa Curry and other members of the external child fatality and near fatality review panel presented and talked about ingestions, safe storage, really tough conversations to have and to hear. I'm sure as our legislators, really had to struggle through some of what they were listening to, but so prevention there's so many prevention opportunities there when we talk about whether it's, a child ingesting cannabis that is on the kitchen counter. How do you store that? How do you make sure that it's up in a way if that is in your home, or like you said, substances like medication or melatonin, or things that are accessible to little kids, especially, that it's just a measure. It's a matter of making sure that our parents and caregivers remember to put those things away, because we've got curious climbers in our homes and they can access those types of things. So, one, we're really grateful for the work of the Fatality and Near Fatality Review Panel, and we're so glad to see our legislators continue to engage the panel, bring them to have those conversations and talk about what they're seeing and hearing and the potential solutions to address those things. I know it's hard to listen to and hear, but it's so critical, because of what we see when it comes to the data, but the families that are impacted in communities by those fatalities and near fatalities.
Yeah, and I can give, to your point about them just hearing about this presentation, I think what we heard from the legislators when they were listening to that data, it was a long presentation. There's a lot of detail about some of those cases. It is hard to sit through and listen to. And I think that our legislators did such a great job engaging around that presentation. So we heard some really good questions about, uh, thanking them for the work, obviously, recognizing how difficult it is, and also trying to understand the data that we have around child fatalities and near fatalities, understanding what that panel's work is, because they had recommendations, with kind of sprinkled throughout their presentation of like what can be done about this. I think our legislators really appreciated thinking about what their role could be in helping with that prevention piece and helping to prevent potential fatalities of children across the state. We also heard, some committee members that were just they learned something themselves, maybe about even in their own home what they could be doing and steps that they can be taking as a parent that they hadn't thought about before, which I think just speaks to like how simple some of the prevention can be if we just had continued education and continued conversations around these things. A lot of this is stuff that we can just go ahead and do today and take care of it and better protect the kids that may be in our home. So that was always very, encouraging and inspiring to see people like, I'm going to go ahead and make that change today in my house, because I heard about this and I learned something new. And then I think that we also, like you said, the presentations were back to back, so a lot of it kind of flowed together. But we heard a lot of really good questions from committee members as well around the data that Corinna was able to present from the Kids Count book, trying to understand how that data is collected, like what is the measure for that? How do they get that data? To really dig into, like, in my community, how do they determine how many people are living, for instance, in a food insecure household? How do we know how many children are going through these different things? And so we heard some really good questions kind of about the definitions, really wanting to dig in. I'm sure as a data geek, Corinna was excited to hear the interest in understanding her part of like analyzing that data. And then again, I think that there's definitely interest from our lawmakers about what their role is. How can they, as elected officials and representatives of people in their area, really make some changes that are positive for kids, which is always very exciting to see.
Yeah. I mean, the good news is we have legislators, especially on the Families and Children's Committee, who are very interested in learning and understanding what the issues are, whether it's stories from individuals who have been impacted, or the data that we have access to and can present to them. But there are a lot of learners on that committee, and I'm biased, but I feel like that committee makeup especially is full of folks who just want to get to the solution. They want to figure out how to address the issues in a comprehensive way. And it's not about the politics or about their egos. It's really about what is best for kids and families across the Commonwealth of Kentucky. And I'm so glad to hear that they are digging into the data and want to understand and learn more. And, as an organization that aims to put out good educational materials and research that is meaningful to our legislators as they're making decisions. I'm so glad that they asked us to join and for you all to present. and really dug in to figure out what they need to know in order to move forward. So, Corinna, was there anything else that you gleaned from the committee meeting, or that you want folks to be aware of when it comes to the data side of things?
Yeah, I have two quick things that I'll add. First, in addition to all of the great state level data that's in the National Data Book, they also do a highlight on data access generally and kind of some of the threats we're seeing at the federal level to accessing high quality, especially sub-state and county level data. For example, the census this year, this is the first year that they didn't ask about food insecurity. So moving forward, there's questions about will we be able to measure that at the county level? So there's a lot of great information and recommendations around how to protect data access at the federal level moving forward within that National Data Book. While we're seeing threats to data access at the federal level, Kentucky also has a really exciting opportunity coming up to enhance data access, but also to secure community level funding. And that's through the 2030 census. So every 10 years, the U.S. Constitution mandates that we carry out a census of the United States population where we count literally every single person who lives here. And using that data, we decide until 2040, how much money do states get, how much money do communities get for education programs, school lunches, roads, all kinds of community programs, and then also how is Kentucky represented within Congress. So there's a lot at stake for us to get 2030 right in order to make sure that we have the money we need until 2040 to support kids and families and ensure they have what they need. So we'd really like to see Kentucky put together a complete count committee and start that planning for 2030 now so that we can get ahead of the curve. And whenever 2030 comes around, Kentucky gets all of the money we need in order for kids to thrive. Kind of as part of that 2030 census process, there's also a huge opportunity for local governments coming up. Next year, they will do what they call the Local Update of Census Addresses, or LUCA, which is essentially where the Census Bureau sends counties every single address that they know about and asks them, is this correct? It's pretty similar to if you're throwing a party and you want to send invites out to people, you'll ask your friends and family, do you still live here? Did you move? Does this house even exist anymore? That's essentially what the Census Bureau will be asking local governments to do. And this is especially important for our Kentucky communities that have been impacted by natural disasters like those in the eastern and western portions of the state, as well as just our communities where they've seen a lot of housing development. We know that a lot of counties have added entire subdivisions, added significant housing stock over the last couple of years to kind of address that need for affordable housing that Alicia talked about. So there's very likely that a lot of communities the Census Bureau might not know about because they didn't exist in 2020. So it's really important for local governments to get that data to the Census Bureau so they know where they are and that we can address kind of those undercounts. And when I talk about undercounts, we know that in 2020, there were some significant populations of youth that were undercounted within the census, meaning once again that we lost funding for important programs for those families. For example, we know children under 5 were massively undercounted in some Kentucky counties. There's also research that's been coming out around how household compositions, and especially households that are grandparent-led or relative-led, kinship caregiver-led, have undercounts and don't always get fully counted. We want to make sure those communities get counted so that families can continue to receive programs like WIC, HANDS, and all the other supports that those populations need. So really my big takeaway is now is the time to start preparing for the 2030 census to ensure that not only do we have access to data to 2040, but also that we have the funding we need for kids and families.
Yeah, and I'll just add, I think from what Corinna shared, just underscoring the importance of having data sources that give us the amount of responses that we need on indicators that we're looking at, and that are, valid over time. We can compare to past years. We've run into this in Kentucky a little bit recently with a change in how they collect data from students, for instance. So KYA is also trying to kind of understand how we can get better data, because as we develop policy agendas and priorities that we want to see changed here at the state level, and also as we're looking at federal data, we can only do that work if we're getting good data in and that our team can kind of analyze and publish for folks. So we're also looking at some opportunities to strengthen the type of data that we're receiving that can really support our policy campaigns as we're moving into Frankfurt in 2027.
Yeah. Yeah. And especially, as soon as the General Assembly gavels out, the next day, our teams are looking at what does the data say about how kids are faring in these sectors? What does the research say? And then what do kids say? And then also often what do their parents and caregivers say as well? So it's really important to have that data at off point for us to go to our legislature to make decisions around what needs to happen. I'm looking forward to 2027. Obviously, it's a short session. It is, but there's still always opportunities to impact how kids and families are faring in Kentucky with policy change, whether it's just a simple cleanup on language or addressing and identifying some of those opportunities as we look ahead to the 2030 census, or as we look ahead to continuing to get that quality data from our kids directly through like the KIPP survey. So Alicia and Corinna, I am so grateful that you all were here to dig in on the data and key trends from our latest National Kids Count data book. KYA is so grateful to be the Annie E. Casey Foundation's grantee for Kids Count, and we are data geeks, so it really speaks to our values and what aligns with our organization, and looking forward to continuing conversations around our Kids Count data book, and then our Kentucky Kids Count project as we move closer to that in late 26 and early 2027. So listeners, we'll leave you with 2 calls to action. The first is share the National Kids Count data book with your state senator and representative, and your top takeaway. You can find all of that information you need to feel equipped for that outreach at kyouth.org/data. And now is a great time to reach out to your legislator during this interim session where they're a little quieter. They have a little more time to dig into things. And then learn more about the Census 2030 and how communities can be preparing for it now at kyouth.org/censusky. Thank you all so much for tuning into the Making Kids Count podcast, and we will see you next time.
Thank you for listening to the Making Kids Count podcast. For more information and to listen to more episodes, visit kyouth.org/podcast. To support this podcast and our mission as the independent voice for Kentucky kids, please consider making a gift at kyouth.org/donate.